Our topic today is combating compassion fatigue. And the first word, combating, is very important because although I'm going to describe compassion fatigue and what that is and why parents who have children with special needs are particularly vulnerable towards this, the majority focus of the session will be on how do you combat this? How do you protect yourself so that it doesn't occur? And when it is occurring, what do you do about it? So I'm going to just briefly go over an outline of what you can expect for today. We're going to start with the associated concepts and definitions. So compassion fatigue is the main topic, but compassion fatigue fits within a whole body of work on stress, caregiver stress, and how you cope with that. And so I want to put it within that body so that it makes sense, and also so we can understand how this occurs and why this occurs. As I mentioned, I'm going to be focusing throughout on how this applies in particular to parents of children with special needs. Now, this topic is very relevant to anyone who's in a caregiving or helping profession. And in fact, the literature and the research started by looking at caregiving professionals, and then someone figured out, gee, I wonder if this could apply to the parents who are in the primary caregiver role. So I will give some examples of how this applies to professional caregivers, but I'd like to say for the majority of it, I will be applying it to parents. And if you are a teacher or a counselor or a therapist or an educational assistant, this will be an opportunity for you to reflect on the perspective of the parent, and also, if you can, switch hats, how this applies to you in your work as a caregiver. I will define compassion fatigue and lead you through that, identifying the symptoms, etc. And then we move on to resilience, and I'd like to say bouncing beyond. So not just bouncing back, but bouncing beyond and actually renewing ourselves and becoming even stronger and better than we were in the first place. Ways of doing that are by looking at protective factors that we have, as well as combat factors. So combat factors are things that you may not already have. You may not have that in your toolkit, but you can learn them, and then you can cope much better. Some of those factors are personal and systems factors that I'll talk about. And then primarily in the afternoon, we're going to focus time on self-care and components of self-care, how you can apply that to yourself, and mindful self-compassion, which is what we will end with. I want to just mention, in Deborah's introduction, she did mention my background. I'm a school psychologist, and I'm also the principal of Poppard. But I have a particular interest in area of focus, which is on mindfulness and mindful self-compassion that I've been pursuing for the last 10 or so years. And I do that outside of my work at Poppard, but I also have found that whether or not I try to separate it, it comes into my work because I'm able to look at others with more compassion, and I really try to practice self-compassion on myself. So my intentions for your learning today are the following: to help you understand these phenomena, and I could have done a whole day on just what is this, what does the research say, because I love all that stuff, but I'm going to just touch on it and then give you some references that you can look at for further information or investigation on your own. Any of the recommendations I'm going to make are research supported. So if you look up the topic of self-care, you'll find all kinds of things under Google. Do this, do that, do the next thing. But all those things aren't necessarily researched. And so I am going to make those kinds of recommendations that you may have heard of, but house it within, here's what we know is effective. And then what I'm really hoping for you participating is that you're able to apply this throughout. So, beyond, listening to the information and, doing some other things in the background, I really hope that you can apply yourself to this and leave with some strategies and leave with a plan of what you can do immediately today and beyond today. So acknowledging what's in the room. One of the things that we learn, and when I start to talk about mindfulness, is a core component of mindfulness is not resisting, recognizing what's difficult, and then acknowledging it. So if we acknowledge what's in the room, I'm going to do that because it will help me and it might help you to help me. This is a picture that I took. I didn't take this picture, but I found this picture, and it was on teaching during COVID, and this particular picture came from teaching in higher education. And so this is just weird. I mean, let's face that, this is weird. And when I was meeting with Deborah and also talking with colleagues about this presentation, the content doesn't concern me. In fact, speaking to a large group, I love it because one of my protective factors, one of the things that gives me energy is getting that engagement and that interaction with the audience. And so there's 300 or 400 of you out there on your end of, the internet and in front of your computer or sitting at home or perhaps in your school. And I can't see you. So I am going to try to engage you and connect with you. But I also have a live audience here of 2 wearing their masks, a technical support wearing his mask, and the video crew in masks. So this is actually what I'm looking at, which to me is quite weird. And I just want to acknowledge that. And I also want to ask your forgiveness in advance for anything, strange, technical, or bizarre that may happen. Yeah, maybe anything. But I'd like to attribute it to the weird COVID situation and having to do this, during a time that's unprecedented. So, setting the stage for you. I want to recognize that parenting is the hardest, most challenging, most joyful, most important, and I've also read most impossible, but I didn't write that, job that you do every single day. I'm also the parent of 2 boys. My oldest son has ASD, and I've been on both sides of it. I was a teacher and a school psychologist before I had children. Then I had children. I had a son who ended up with the diagnosis of ASD, and I thought I knew what ASD was, and he didn't have it, but in fact he did. So I've been on both sides. I've worked with and, let's say, experienced dealing with the various institutions, the school system, the medical system, etc. And I have to say that that whole experience of being a parent and navigating a system, including the system that I was used to work in, was very informative, was probably my greatest learning beyond any books that I've read. And so I want to acknowledge you, the parents, that your expertise and what you're bringing forward, hold on to that because it's huge. And so I am tailoring this towards the parents. And I'd like to ask you to do this. So if we weren't in the COVID and you weren't all sitting there and we didn't have people in masks, I would love to make this a really nice, cozy session. You could come in and we'd have comfortable chairs and we'd have cups of tea and things like that. So if you're able to do it on your end, go do that. Go get, some tea, put your feet up. But today is about you because the focus is on relieving any compassion fatigue. So take care of your knees. Go to the bathroom, stretch. It's not self-compassionate to just stand still like I'm going to attempt to do. I like to move a lot and I'm, tethered here. So you don't need to be. Stretch and make a U-turn. And so by U-turn, I mean, as parents, you're always giving. And so turn that giving towards yourselves today. Try to make that U-turn to the best degree that you can. Be kind to yourself. And I hope that this session will validate the journey that you've been through, that you're going through, and provide some seeds of support. I'm saying seeds because it's just a little touch of it, but I really hope that's my intention for you, that that's what you get from this. I'm going to ask you to grab a pen and paper, not so you can take copious notes on words of wisdom. The times I want you to write things down, I'll invite you to do that, is when you are going to reflect and apply this to yourselves. So if you don't have a pen and paper, maybe go grab one. You also have the handout, and there's several other handouts that came in the package. And if you have those, you can have them by your side and be prepared to use them. If you don't have them, just a pen and paper to write down main ideas. So we'll start with the joys and challenges of parenthood. And I always have to smile when I say joys because they're absolutely there, but sometimes it's really hard to reflect on those, I know from personal experience. So for some, apparently, I don't know who this is, but according to the research, it's very easy for some people to transition into parenthood. I know when I was first pregnant, I thought, this will be fine. I'll just continue to do everything. I'll travel, I'll work, it'll all be great. And then I was in complete shock when really I couldn't do any of that. Whether or not my child has special needs, just dealing with an infant was, anyway, not easy. But apparently it is for some. But for most parents, regardless of the state of your child or your family, there's some level of anxiety, there's exhaustion, and there's stress that accompanies parenting. So that's absolutely normal. If you're a parent and you're having stress from parenting, or you're thinking, I don't really like this isn't what I signed up for, where's the rocking chair and all the nice music happening? It's not happening. I know I thought that. It's normal. That's normal. But if you're a parent who has a child with a disability or a chronic condition, we know that, I know from experience, you know from experience, and the research has validated it, it is monumentally more difficult. There are considerable more stressors as a parent with a child with special need. And we're going to talk about that and then how to incorporate some ways of supporting yourself. But I also want you to keep in mind, and we'll be spending most of the second half of the presentation on this, so I don't want you to get bogged down some horrible tunnel of doom here. There is a lot of joy in having a child, including a child with special needs. And there has been research on this component. There used to be the assumption, a parent has a child with special needs, that's the end of it for them, it's all doom and gloom. But in fact, parents are able to identify particular joys of having that child with special needs. And a lot of it is due to the human capacity of empathy. It can bring you both joy as well as distress. So, what is empathy? It's that ability which is uniquely human, although I've done some research on this and I really believe it. Some animals are capable of it, some mammals, especially advanced primates, and apparently even crows, so are able to understand and experience the feelings of another. We know that physiologically, I shouldn't say just, but that transition of becoming a parenthood enables your capacity to experience empathy, and that's largely due to hormones that trigger oxytocin for women, and men have vasopressin, so they're also capable of being empathetic during parenthood. We know that it's a skill that's absolutely necessary for therapists, for effective teachers and support staff. And Carl Rogers, for example, talked about empathy as being necessary and sufficient for effective therapy. So you need to have it. And if you're a caregiver and you have that, then that's also why you're at risk of compassion fatigue. So it can be both positive and negative outcomes as a result of it. And a really important thing to keep in mind, and I'll probably harp on about this a bit, is how we manage it. So experiencing that empathy is a great thing, and we need to do it, but we also need to learn how to manage it. If we look at stress and how we cope with it in relationship to our lives, something that we know is that it's not just a thing. So people talk about, I have a lot of stress. And then you ask, what do you mean by that? And they might say, well, my kid is, annoying me at home. My husband doesn't do the dishes. A family member died. Those things are events. But stress is actually the relationship between those events and yourself. It's very relative. It's very individual. And so psychological stress, which is what I'm talking about, I'm not talking about physiological stress, which physiology is a symptom, but there are definitions of physiological stress, meaning, something happens and your body escalates. So psychological stress is a relationship between the person and the environment that is appraised by the person as taxing or exceeding his or her resources and endangering his or her well-being. So I want you to keep that in mind. It's a perceived thing. It's real, for sure. So when that video wasn't working, I was feeling stress. I'm like, this is happening. I don't like that it's happening. I can't manage this. I don't know how to fix it. Someone asked me a question about something on my computer, and I'm like, I don't know. So I was feeling this stress by something external that was happening, and it was impacting me. Other people in the room are looking really chill. Deborah's having a nap, stuff like that. So they're fine with it. Just because the audio doesn't work on your computer doesn't mean it's automatic stress, okay? And so the responses are physiological, things like your heartbeat increasing, flushing, you could feel sick to your stomach, you could have to rush to go to the bathroom, hopefully I don't have to. Psychological, so things that you're thinking and things that you're feeling, like I'm thinking, this is terrible now, this isn't what I planned, people are gonna hate this. And behavioral, which could be fleeing from the room, which Deborah's got me stuck here, so I can't do it. But those are some of the things that happen. Now, here's a little bit of the research that I hope you will find applicable. So this is the model of ecological systems theory by Bronfenbrenner. This is a model of how things within our system impact us. So stress is one phenomenon that fits within that systems theory. So in other words, just to simplify this and make it applicable, you're an individual, so that's you in the middle, and you have your own characteristics. You're male or you're female or you're whatever you are, you're young like me or old like, Deborah. See, that's the other thing. I can't even get people to laugh. So if I make a joke, I'll just assume you're laughing so I don't have to. You have your own health issues or concerns. You have your own ways of coping. And later this afternoon, we're going to look at those things. What can you do to increase your ability to cope with it? And then you have those things in what's called the microsystem. And so for parents, we spend a lot of time when we're parents dealing with all these microsystems that we never had to before. So we've got the school. It may be a source of stress or not. We've got our family. Guaranteed, in my case, source of stress. We've got health services. We've got our church group, if we have them, or other groups. And some of those may be sources of stress or not. And then the mesosystem, also very important for parents who have kids with special needs, that's that interaction between the systems. So what's happening between the school environment and the family environment? What are their communications like? How about between the school and the hospital system or the private service provider? What are those interactions? Actually, for children with special needs, that has been deemed to be the hugest source of stress. The interactions and the navigation of those areas of the microsystem. And then outside of that, what influences us are larger things like what is the social welfare system or the support system or what's the media saying? And further out, attitudes and ideologies, which all of these things evolve over time. So, for example, if you were in the 40s or the 50s and you had a child with special needs, there were very different ideologies about whether or not those children should be included, educated, thought about, put in a separate institution and never seen again, those sorts of things, which of course would impact you, and they change. So those are, that's just kind of a little snapshot of how these various systems influence you. So when we look at caregiver stress and model, Raina is one researcher who has done a lot of work on this area. So the characteristics of the caregiver, that's you as the parent or the caregiver, the recipient of care, so in this case it would be your child or individual family member who has a disability, their shared history, and the social, economic, and cultural context within which they find themselves combine to create an infinite variety of circumstances from which stress may both originate and be managed. I'm getting stressed just thinking about that, actually. I don't know about you guys, but the point is it's not one thing that's going to happen. There's all these things that can happen to cause stress. The really good news is there's lots of ways to push those out of the way and support. Okay, so it's multidimensional. So what I'd like you to do for a few minutes is think about your own sources of stress. And in fact, you have a little handout that looks something like this. I'm going to have you start with this and then come back to it later. So you don't need to bother about reading the instructions. So just think of characteristics of your child. Are there any characteristics of your child that cause stress for you? Like, let's say, challenging behavior or, refusing to get dressed every morning, whatever. Your own characteristics. What are some stressors for you? Like, say, being a perfectionist. I don't know who that could be, but that can cause a lot of stress. Your family. One of my staff, actually, when I was going over this with her yesterday, said, well, rather than having people write this down, you could just get them to take photos, and I'd just put a big picture of my family here, and that would describe it. So individuals within your family that are stressors for you. How about the school system? Is there anything going on there that's stressful? You know, not getting enough support, or a relationship you may have with some of the staff. Or if you're a staff member, also maybe not getting enough support or the resources that you need. Medical or treatment centers. Accessing the services, waiting for the services, finding the services, having good services. Your work can be another source of stress. Are there things about your work that are particularly stressful, and anything else? So I'll give you a couple of minutes just to jot down some ideas on that. So from our large audience here, I'm going to ask if any audience member is willing to share some examples of stressors that they were able to identify in any of these categories.
So you're asking about characteristics of my child of special needs, who's now a young adult. I guess it's, you know, the challenges he has communicating, which leads to challenging behaviors because he's frustrated because he can't communicate. So that's one big issue. My own personality, for those who know me, you know, fairly intense, tend to be a perfectionist. Family, like many of us, aging parents, 4 generations in a triple-decker sandwich. You know, medical system, having to rely on the medical system for many members of my family, you know. The other questions you had, prompt me now. Oh no, I can look at your screen here. Okay, the school, luckily I'm not dealing with the school anymore, but that is definitely a source of stress for many families, and was certainly for ours. Work, I think one of the stressors that I'm finding now is that we know from the families who are in communication with ACT how many of them are in really difficult situations. So I think a lot about what those families need and how we need to be working harder, and of course balancing it against the needs of our staff members who also have children with special needs and aging parents. So I think we're all feeling that, you know, and I'm sure this is something that teachers are also feeling, their needs to look after their own families and also their students. So we're all feeling on multiple pressures. Other stressors, I think I've just about wrapped up. I think I've touched all bases, Georgina. So maybe I can turn it back to you.
Thank you, Deborah. Just hearing that and, you know, using empathy, which sadly you didn't get to see the film about, but walking beside Deborah in her experience, you know, brings on a certain degree of suffering for me, which I'm going to talk about. And so I am just going to offer myself a little bit of self-compassion at this moment, do a little bit of a U-turn to help soothe some of that feeling that I'm feeling and some of you may be feeling, especially when you take time to identify those stressors. You know, lots of times we don't think about it. We don't want to think about it. We might push it away, like it's fine, it's fine, it's fine. But what we're going to do today is try to bring some of that forward and then learn to manage it rather than resisting it. Because when we do resist it, it actually feels worse. It may not immediately feel worse, but you resist it and hold your fists tight. And when you release them and just recognize they're here, it can actually be very nourishing. So I'm doing that myself.